my name is Moncivaiz, and this is my certification video for adult, child, and infant AEDs. So the first thing we're going to do is that if we have a patient or a victim under cardiac arrest, the best thing to use is an AED. So if we are in the middle of CPR or we arrive upon somebody, the first thing we need to do is always get an AED besides call 911. Okay? So as soon as an AED gets available to you, you're going to push start. So after I push start, I'm going to start cutting open the victim's shirt. Okay? Okay? And we're going to make sure that the chest area does not have any clothing. And we're also going to make sure that there is no sweat on the body. Okay? We're going to clean the pads of the AED. Okay? And then after we do that, we are going to make sure that the victim doesn't have a pacemaker or have any medicine pads on them. Okay, and we're going to make sure that the victim is not on a metal surface. We're going to make sure that the AED is never used in water or in a moving vehicle, and we are going to listen to the AED as it's voicing its instructions. Okay, so I am going to put one pad on the side to side underneath the nipple, and another pad up and down on the top right shoulder. Okay, and I'm going to make sure that the wire is run through the middle of the chest. Okay, so put that there, make sure it's in the middle. Okay, you are going to make sure that you are not touching the victim whenever the AED is either analyzing or shocking. Okay, so what I am going to say is analyzing, stand clear in a loud voice, and plug it in. Okay, do not touch it while it is analyzing. Okay, so basically whenever the AED stops analyzing, it's going to tell you whether the victim needs a shock or not. So if it needs a shock, then what you're going to say is stand clear, shock, and push the button. Okay, while making sure nobody is around the victim, not touching them or anything. And we're going to make sure that no cell phones are 5 feet near the victim either. Okay? And so after we do that, we're going to listen to the AED, which means that if the AED says that there's no shock needed, but there's no signs of life in the victim, we are going to continue with CPR. So we're going to find the xyloid process, and then we're going to continue with CPR. So 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, all the way to 30 while doing the head chin tilt lift, blowing to rescue breaths. Okay, and then we're going to listen to the AED if anything changes, and we're going to continue to do this until an EMT arrive. Okay, this is also something that is used on a child and an infant. A child, if they are younger than 8 years old and weigh less than 55 pounds, we are going to use pediatric pads in the same areas that we would an adult. So under the nipple, on the left side, and on the upper right side shoulder, up and down. Okay, and with a child, what we are going to do is we are going to use the pediatric pad in the middle of their chest area, and then we're going to put the other one on their back mid area. Okay, and we are going to listen to the AED, and that is how we use the AED.